CDC data shows Black women are 3 times more likely to die from preventable pregnancy-related causes than white women. And in Illinois, those statistics are even worse. But leaders with Near North Health are working to turn this around. Advanced nurse practitioner Dr. Sandi Tenfelde is here to tell us more. Good morning to you, Dr. Sandi. It's good to see you.
Thanks for having me.
So first, let's talk about these inequities. And what does the research tell us about why they exist?
So we're still trying to really understand why there are inequities. We know that there are so many issues related to our healthcare system in terms of systemic racism, access to care issues, in addition to many chronic conditions that affect Black women specifically that don't get diagnosed early and can lead to complications with their pregnancies and in that first year post-birth.
Mm-hmm. And it was really kind of shocking for me to learn that when you look at other well-financed, well-resourced countries around the world, the U.S. has a very high mortality rate for pregnant people.
Absolutely. And I think that it really shines a light on the work that we need to do to reduce these inequities, to make sure that everybody gets high quality, cost-effective care, and that we can work to reduce the disparity. No birthing person should be dying from a childbirth-related problem in 2023. The fact that we're still talking about this is outstanding, and it really highlights the work that we need to be doing.
Okay, so first stop, raising awareness. Secondly, tell me some of the things that you're doing at Near North Health to try to change these outcomes for Black mothers.
Yeah, thank you. So Near North has 9 community health centers across the city. So we are bringing care to the patients where they live within their communities. This is increasing the access to care. We have a comprehensive approach to prenatal care where we have case managers through the Better Birth Outcomes program, where every birthing person is assigned a case manager who gets to know them in addition to the clinicians like myself who will see them throughout their prenatal and postpartum period. We offer prenatal education classes. We also have WIC, which is Women, Infants, and Children, so they work with nutritionists to make sure that they learn about healthy eating during pregnancy, and they have coupons to help get healthy food. So it's a total package in order to be able to provide the care for our patients.
But the idea, and what's key to that, is developing relationships,
Absolutely.
right? So that patients can advocate for themselves,
yes.
And the people who are taking care of them can listen when they say, hey, something is not right here. Because that's a big part of the problem.
Absolutely. We absolutely need to listen to our patients. And I think that is one of the things that sets us apart, is that compassionate care that we give. We have this time where we're able to sit and listen and understand what their hopes and goals are for the pregnancy and how we can help them be as healthy as possible.
What else would you like to see done to really turn this around?
I think that we need to start really thinking about reproductive rights and making sure that patients can have advocacy for if and when they want to become pregnant, and we can work with them prior to pregnancy to get them to be as healthy as they can be, so that the pregnancy, any early problems are identified and treated early, so that we can help them have as smooth and healthy of a pregnancy as possible. And that if there are any complications that arise, that we have networks in place where people don't fall through the cracks or have challenges with accessing care. With the close of a hospital on the south side of Chicago, we have often, deserts where patients are not able to get the care that they need. And it's a very fragmented system, which is really to the detriment of our patients. We're doing the best that we can within our community health center to find the connections and to make the outreach and to make this as smooth of a process as possible for our patients. But it's challenging to navigate, which is why having a team is so important.
Dr. Sandi Tenfelde, thank you so much. Such an important conversation to have. Near North Health has multiple locations. You said 9 locations. Correct. Around the city of Chicago, and you can learn more about their services at their website right there, nearnorthhealth.org. Hey, Tim.